Hey guys, it's Sunday morning and we are doing something new. We are doing KOL today. This is Key Opinion Leader. We are going to be interviewing many celebrities, influencers, beauty gurus. We are going to talk about beauty hacks. We are going to give you guys the insider information that you have been looking for from the leading world's experts, all from the comfort of your own home on Sunday morning, typically with a little coffee or latte, a little Lucy & Co. plus my Nude Skin lip butter, and I have my gorgeous Celeste Elle Harmony Los Angeles candle right now, handcrafted with crystal. Take a look. This is from my good friend Kirsten. You guys all know Kirsten Maldonado. Support her company, Harmony LA. But today we're going to have one of our biggest, I'm so excited for our first KOL to have Lord Gavin on. He is a celebrity skin guru. Not only is he brand ambassador for one of the biggest skincare lines, he knows skin like you wouldn't believe, which is unbelievable. And he just takes care of so many celebrities, makeup artists. He's in the industry that he knows so much about skin that everything you are going to hear from him is going to give you so much information. We literally should be charging for this, but we're giving it free because we want all you guys to get that insider information. So I'm going to bring Lord Gavin on and we are going to start KOL. I know, look at those lips, you guys. Nude Skin Lip Butter, emeragecosmetics.com, and also Lucy & Co. Lip Plumper. So Sunday morning, I'm going to bring you the celebrities to you. Not only I just want you guys to know because it's so unbelievable. Lord Gavin has been crowned the king of the red carpet prep. Kim Kardashian, Kendall Jenner, Kylie Jenner, Sofia Richie, Kristen Stewart, Michelle Williams, Julianne Moore, Linney, literally everybody he is taking care of. It's unbelievable. So I'm going to bring him on right now. Let me request him and we're going to get started because it's going to be an amazing, anything you guys want to know about skin, about celebrity prep, red carpet events, ask us. You guys know I talk to you all the time about growth factor and peptides, antioxidants. I talk to you about procedures in the office and what you can do to keep your skin looking amazing. That's what we're going to discuss. We're going to talk about so many different things that... All right, let me text him. Hold on. So many things that just keep, hey guys, hey Training Academy, and we can talk about so much about skin and taking care of it by so many influencers and those that are in front of the camera or taking care of those that are in front of the camera. Redness on the face has many causes. There he is. We would need to talk with you why you get that and how to treat. So come to emeragecosmetics.com. Let's do a consult. There he is.
Hello, good morning.
Good morning. How are you?
I'm excited to be here. And after that introduction, whoa, I have much to live up to.
I know. And it's only Sunday morning. Like if it was like the afternoon, or I probably would even be like fireworks would be going when I was doing that intro.
Well, good to know.
So talk to me a little bit because we're doing this new live called KOL, which is basically Key Opinion Leaders. We want people to know the insider tips, tricks, beauty hacks, things that, you know, everyone wants to know about skin, but they don't get because all people do online nowadays is just tell people to use a product. They don't really explain the process, the science, you know, and they don't bring in influencers like you that actually work with the skin, that know the skin. That's why I wanted to bring you on, because you're literally the world's leading expert in taking care of skin before it goes on the red carpet.
Well, I'll take that. And I'll certainly say that the interesting thing about the whole beauty industry and skincare and all these aesthetic treatments and celebrity is that it's very overwhelming and it's very confusing for consumers who want to want to fight through the noise and figure out, okay, what are some of the key things that I can start to implement to give me that unbelievable, what I call enviable skin or high school reunion skin, right? That's what we're striving to achieve in our lives. And so you're right. There's so much information that I like to cut through the noise and tell people exactly what they should be doing. And working with physicians like you to advocate for my clients to see for some of the more robust attention that they might need.
Exactly. I mean, you know that everybody needs regular maintenance, right? They don't need to be getting a laser every couple weeks. They don't need to be getting fillers, Botox, and surgeries often. So that's why there's a extreme trust in someone like me where they put their hands under, let's say, the knife or the laser, their face under the knife or the laser every couple months and have that like little bit of downtime, but then they're going to you more regularly, right? They're doing their maintenance, they're doing their everyday skincare. It is
Exactly.
really a team approach. Don't you feel like it's a beauty team that people need?
Totally. I always say you can lift it, you can freeze it, you can fill it, and you can fry it. But if you're not addressing healthy skin function and balance, then you're not going to look younger. And so I think it is a combination of doing the more intensive treatments. Maybe we want to re-augment our faces. Some of us are lucky to be born with faces we love. Some of us want new ones, right? So we have that. We also have genetics, and there's some cases you can only go so far. And so if we have everything working in synergy and healthy and clear communication on a cellular level and a skin level, then all these other more intense treatments just look so much better.
And that's actually why I created my skincare line, to actually help people heal. And it wasn't necessarily about after a laser. It was actually, even my Airify kit was designed to be used after facial.
Mm.
It is designed overall. You know, you're constantly being exposed to environmental damage, to internal stressors that play a huge effect on the skin. And that's why you need to be really proactive with aging in doing the things you need both externally and internally to supply the nutrients, to help with repair and protection. And it's not just getting a treatment. Sometimes it's those everyday routines. Sometimes it's even just meditation, water, things that people need, supplements that we were talking about the other day that you need, because people will come in, and I know we talked about this a little bit, and spend a lot of money on a treatment and never do anything else to complement it. How do you feel about that? Because that's not what we're trying to educate about. We're trying to educate about a lifestyle, holistic approach to taking care of the skin, not just a one and done treatment and then hoping to try and reverse everything.
Yeah, I think if you look at the aging process now, and when I say the aging process, I mean people who are actually investing time, commitment, energy to looking their ultimate best. And I'm also a big believer in this idea of proactive aging rather than anti-aging. Anti-aging, what's the opposite of that? So we all want to age, right? But we just good as so. If you look back 20 years ago, there was a very clear Beverly Hills. Everything is tight,
Oh yeah.
juicy, right? Everything is up, and the earlobes are big with big earrings, but nothing looks youthful. Lucky. Because we have intelligent, smart skincare technology. We have, fillers that are so much more sophisticated than when they first came to the market. We have injectable moisturizers. We have oxygen and hydrofacials. We have radio frequency. There's so many things that we can be doing to keep the skin alert and alive. And one of the things that I'm really fortunate about, I try every product under the sun. And I was always very frustrated because I was saying to my client, use this, use this, use this, use this, use this. And they're like, do I really need 21 products? I'm like, yeah, you kind of do. But then I joined Augustina Spada, which I know that you know well, because I a very curated, highly concentrated, smart skincare that really adapted to the individual needs of the client to give them what they need in real time to meet real quantity results. And it starts with having a good skincare regime, and then we can sort of spread out from there.
I actually think that's fantastic because I do use about 10 to 15 products, but they all do different things. And a lot of the new age products are very designed towards individual needs, towards addressing the cellular level, before it gets to a point of damage. Like, you want to treat your collagen and elastin before it's damaged. You want to keep it fresh. You want to keep it healthy. It's just like your body. You're exercising every day, not to necessarily live longer, but it helps you do that. And you don't even realize you're doing it. You take supplements every day and you don't see an effect of it until way later in life, but you're doing it every day because you know it's going to keep you looking better, living longer, feeling better, preventing the aging process, arthritis, all those things. And that's what I think people need to be proactive, like you were talking about. It's about that prejuvenation, doing things before it occurs, because when it does occur, when you do have the wrinkles, the sagging, then the treatments that you do don't look as good. They're not fillers don't look great when somebody needs lifting. Then it looks like they're a pillow face, right? They're overdone because you're putting the fillers in to lift. We need to do these treatments early. So I actually did a great article recently that's going to be coming out in a big magazine about the differences in what treatments you do at different ages, 20s, 30s, 40s, and 50s. I know. And it does change. It does change because at a younger age, we're actually doing some of those treatments that we were doing before in our 30s, 40s, and 50s, because we're proactively preventing the aging process, getting exfoliation, regenerating that collagen. I do a peel pretty much every week or two, and people look at me like, you're crazy. But I say that's because I don't want to look. I want to get rid of. I don't want skin cancer. I don't want sun damage. I want to prevent wrinkles. When I look at your skin, it's flawless because you're doing all those things. I know you look so great because you're doing all those things that we are recommending people do now to be preventative, because it costs a lot less in the future and it's much better for your skin overall. We don't need to burn our face off to get a result. You can be using these high quality cellular level products that address all different components of aging much better now than we ever had before. It's not just about Retin-A anymore. You know what I mean?
All remember those terrifying visions of their workout, their Tracy Anderson classes, right, wiping away the burning tears from their eyes because of Retin-A and the sweat lining in one moment. And so hydration is really key. I think hydration is something that we don't spend enough time talking about.
I agree.
And I think that we have to, like, for example, if I'm coming to you for more of an intensive treatment, I love the wound to heal process. Don't get me wrong. There's something about feeling very pop culture when you're hiding for 2 weeks from the public, right? It's kind of fun.
100%.
That being said, skincare, morning and night, aggravating, shouldn't be sensitizing. Not into this idea with everyone's microneedling kits and so on and so forth that we have to wound ourselves daily to improve our skin. We don't. We can have a gentle, sophisticated, pragmatic approach to our skin to make sure that everything again goes back to healthy skin function. The ideal goal is that when I reach 45, I want my skin to function like it's 28 years old or even younger if possible, right? So that's the goal.
Agreed.
Have that communication. And then what happens in that point? I come to you and I say, you know what, I'd like a bigger jaw. Or you know what, my tummy is a little up. Can we work on that? And my skin is so primed and prepped that the recovery is expedited, the downtime is mitigated, and the results are enhanced. So shall we jump in?
I love that.
That we love to do.
I love that because one of the biggest things about me and my practice is about prep, is about speeding up healing and making sure that your skin is ready and able to do the treatment. And I agree with you. I don't think you need these big wounds to heal, like you said, or daily damage. I do think, though, I do believe in exfoliation and energy-based treatments as well as topicals. I mean, look, I used 10 topicals this morning because I think it does so much for your skin, but I'm still doing a light laser every month. I'm still doing a peel, a light one every couple weeks, and I'm doing my facials and my skincare, and every 3 or 4 months a bigger treatment, because I don't want sunspots. I don't want to get skin cancer, and I want to look better than everybody my age. So I do that to regenerate the collagen and keep things tighter, so that we just look better as we get older. And I always tell people the technologies now are designed to do that. You see all these ads of lunchtime, laser, no downtime treatment. Some of those are actually true. Some of them do deliver heat to the skin without any evidence that it was done. And it builds collagen and helps support, oil production that's more natural than overdone. And it helps hydrate the skin and create channels where great products that we talk about all the time can actually penetrate and work. Because if you have oil and you have dead skin, are those products going to actually penetrate?
Not really. You got to clear the gate by the cards come into the castle, right?
Exactly.
You said something really interesting here because you talked about your regime, right? You talked about that you do more of a heavy lifting approach every month or every other month or so, and then you have this sort of regime of a light laser. Now, I always laugh because when people come to me, or even people of friends who aren't in the industry, they have this sort of mindset that when they have a laser or they have a peel of any kind, they're going to be like Samantha in Sex and the City. They
Best episode.
And they're terrified of looking like pizza face. And that raises two questions that I'd love to talk to you about. The first of all, I'd love to talk to you about what some of the light laser or entry point technology start to explore. And then on the top of that, I'd love you to talk a little bit about the recovery process, because I believe, and I've been there myself, when I first started having, fillers and all sorts of stuff, and I had lasers, I would have that moment I call the 3 p.m. moment, right? Everything is fine and dandy. You have your treatment. You're feeling good. You get up in the middle of the night. You switch on the light. Let's have a look at what's going on. Oh, my God, this is terrifying. And you start to lose the trust that your body knows how to heal and recover. So I'd like to talk about those two things, entry point, and what can we do to trust ourselves that biologically our body knows what to do to make the most of this technology.
Well, I love that because nowadays it's actually really hard to know who to actually go to for these entry point services, because there's so many I hate to say uneducated because I don't want to sound mean to people, but there's so many people that are new to the industry. They're getting into it for the wrong reasons or whatever purpose, and they're not experienced. And you want to be very careful who you actually go to, especially with energy-based devices and injectables, because this is your face. This is what you're promoting to the world every day. And you can get burned, you can get damaged, you can get side effects from these things. So you really need to go to somebody who's expert. That's why we're doing KOL, because I'm introducing you guys to the world, to these key opinion leaders. That's the point. And myself as one of the major key opinion leaders in skincare. But what I think is there are newer technologies and devices that don't have a lot of downtime, but they work much more at the cellular level to turn the skin cells over. You may look red for 1 or 2 days. You may get a gritty texture on the skin from exfoliation, but you can go to work. You don't look bad. Some of my clients actually will do a laser like Clear and Brilliant or something called Moxie 1 or 2 days before red carpet, and they look unbelievable.
I recommend that to everybody.
Yeah, that's resurfacing. I usually tell people a week or 10 days before, just to make sure. Maybe we use a lighter peel, some skincare with it. We may even put my Aerify kit, for example, is a light TCA peel with retinol. I have people do it every 2 weeks at home. You're literally red for a day. We do it with micro rolling at home, derma rolling, and you get amazing results. A Crystal, who's actually on here responding, she has Asian skin type, has been burned in pigmentation in the past, loves the results. So, it's those types of things. There's also microneedling. It's become very popularized lately with PRP, using blood plasma on the skin. There's conflicting evidence as to if that actually makes a difference for the price, but it does help pigmentation. It does help penetrate the skin when done properly and not with scratches and overly damaging the skin, to rebuild collagen and improve the ability for your products to penetrate more. So if you get this microneedling every month along with your facials, you're going to get much more out of the skincare products that you use. And then again, that's in the energy-based arena. Now, there also are, for those with darker skin types and sensitive skin types that are nervous, you could do microneedling with radio frequency, which is basically needles with heat. And that actually helps tighten the skin more. So for my patients that want texture and tightening, there's things like Fractora, Morpheus, Endymed Intensive, Infini. There's a slew of them now. Secret RF, all of them work to heat the skin at a deeper level for tightening, but are colorblind. So they can treat African American skin. Like a doctor on here right now is saying Morpheus 8 for the win. That's one of our favorite treatments. I actually helped create it. It's one of those things. I know I'm like crazy. We were trying that years before it even came out. So it's amazing what you can actually do, and really in synergy with what you do, because I even have people that day do a microderm or a facial, get the treatment done, and then immediately do oxygen and a jelly mask.
Yeah.
And they walk out like they're ready to go on the carpet.
Yeah.
You know?
Yeah. I have a very specific, and it's funny because you mentioned a lot of the things that I advocate. So I have a very specific 27-day regime leading up to the beginning of award season. And so what I do is
I love this. I love it.
Have somebody go in and have, you know, a moderate peel. We don't want to go crazy in this far out, but I do something EI peel I love.
Mm-hmm.
Works with, as we just talked about, it's so hard to find peels that work on all different types of skin color. And that's a that I think that you've been an innovator in too, is bringing lasers and peels to African American skins, to darker skin tone, because oftentimes traditional peels have that terrifying effect of creating hyperpigmentation that is the complete opposite of what we want. So I always advertise you do a peel. And
I love that.
I put them on the Bardo regimen. So I put them on either the rich cream or the cream. Why I do that is because, as you know, Professor Bardo is one of the world's leading scientists. He's a real leader in stem cell biology, and he's one of the world's foremost regenerative doctors. What I love about his products is it has something called TFC8, a trigger factor complex that's based on over 30 years of his research and innovation. And this is what we were talking about, giving the skin what it needs. It's comprised of high-grade amino acids, medical-grade vitamins, and synthesized molecules. And the exact combination and concentration is found naturally in healthy young skin. And it guides these key nutrients and powerful natural ingredients to the cell to create the optimal environment. When we look at the cell turnover, we know in the 27 days, that's the main cycle. So if I can get them peeled beginning, then have these incredibly healing, nourishing, protective, and also giving more information to the cell during that time, then we can start to look at something like Morpheus 8. Then we can look at something like Intracell, which I think is basically an offshoot. Mm-hmm. Then we can start to add in oxygen facials and silk peels leading up to that premier. I think in combination, these things work so well to give you skin that looks like you've barely lived. And isn't that
I agree. I love that. And I actually made, so my Aerify, so I like exfoliation more than I like what I call shedding. I did an entire 1-year fellowship where all I did was go into like a scientific lab and mix peel chemicals from the direct manufacturer and use them on skin. It was old school dermatology. I would make, you know, Jesner combination, TCA, aggressive. We did phenol peels. I did everything. So I've seen the gamut to looking like nothing was done to looking like you went through a flamethrower. And with that said, I created, I believe that turnover is actually even a little bit better than shedding, because shedding requires the whole surface to come off. Turnover is more of like regulating how your skin peels. So peels like Cosmetic and Enlighten tend to, I think, be a little bit better for long-term collagen production and complement lasers even better, which is why I made my Aerify. My Aerify is a mask that's made of brightening and light and exfoliation. So the brightening is kojic acid, arbutin, niacinamide, and vitamin C. Beautiful. And the exfoliation, which is great, and it's all good for every skin type. And then the lightening or the exfoliation and or treatment part is TCA, salicylic acid, and retinol, basically. And I like it because you can do a VI or you could do a Rev peel or you could do a TCA a month before and get that turnover. And then you can apply this with those light facials, with the great growth factor and stem cell products. And keep your skin turning over and fresh from when its new canvas is there, because you just exfoliated the surface. Now, instead of waiting for it to turn over again, you can get light peeling every day, which you can't even see, but your skin just looks bright every day. And it's something you can do every couple weeks. I actually want you to, I want to get someone, or have you and I do it together, so you could see the difference, because it really does make a huge difference. I think with the cream you're using for Augustinus Bader and using the cellular level transcription factor creams, you're going to hit it from each level. The turnover that's coming from the surface, but the stronger signaling molecules much deeper. While the skin is regenerating, it needs those nutrients, it needs those signals to produce better collagen and give an overall more glowy look. That's why I created that initially, because I wanted facialists to do their peels and then add this mask, and combine it with their products, because frankly, I don't think every product line has everything you need, but I do think a lot of them have major components, and some people it's better than others. So I made the kit on purpose so that I could take someone like you, educate us a little bit more, and add in those products that you're recommending
into the regime very easily.
Synergize, it gets better. And I think those are some of the entry points, I think, right there. Trying those lighter peels, trying those at-home masks, doing these more facial-like treatments such as oxygen and silk peel and hydrofacial, etc., before you even get to the laser. And then when you start lasers, doing the lighter ones like a Clear and Brilliant before you get into a Fraxel, a Halo, or a CO2, because you may not actually need it. It's not an age thing. It's what we have on the surface to determines. Yeah. If someone has terrible acne scars, we understand a facial's not going to get rid of the scars. Their skin may glow, but it's not going to get rid of their scars. Their skin may be healthier, but if someone really wants that result, now we have to figure out, now we have to go to someone like me that can do those treatments and work with you to keep their skin healthy. But I think to even start the CO2 laser resurfacing, they need you. They need to prepare with the creams you're describing. And I even have them do exfoliation peels 2 to 4 weeks before. They're doing that, the turnover that you need. You can't go run a marathon without training for it. That's what I tell people.
What people do wrong is they have these big treatments, right? And they think, okay, that's it, I'm done. And they go back to just a typical routine that's not working for them. I always say it's not that different from Zoom whitening your teeth, right? They get really white, but unless you keep brushing and you keep...
Of course.
They're going to go back to the way they were before. So we have to keep the maintenance going to stretch the results, to enhance the results, which means next time I come for my second round of laser, before you know it, I'm embryo. Hello?
Yeah, exactly. I love that. It's perfect. And, and then afterwards it's the regimen, that you follow as maintenance. A lot of my patients actually fly in and see me every 3 or 4 months. I need to collaborate for bigger treatments. They get their Botox, their injectables, and their laser. And it's all done at once. They stay a day or two to recover really quickly before they go anywhere if needed. And then they go back and see you. And they're seeing you more frequently than me. So I need to be able to have these types of conversations with people. It's not about competition. It's about synergy and collaboration. The products that you're doing, the steps that you're doing only enhance what I'm doing and give our patients so much better of a result. That's the key. And that's why I wanted to bring you on too, because you're really taking care of the world's most seen, and they are going to whoever for other bigger treatments, but they're coming back and seeing you for the glow, the prep, the daily routine. They're seeing you more frequently.
Yeah, it is a doubt. I'm always making recommendations to who
exactly.
Because I also want to know that when I see you in May and you come back in the room in October, I know who I'm looking at. But
exactly.
Well, this would be interesting because I do want to touch upon the fact about trusting your field. But before we get there, what is your biggest frustration with people like me? Not me, because obviously I'm great, but big treatments. You give your client a really wonderful, I would say pretty scientific, holistic overview of what they should be doing. What is your frustrations when then your clients go to estheticians and day spas and hotels and whatever, and they start doing things that aren't quite aligned? Like, how do you deal with that?
Well, that's what, this is the whole reason I thought of this actual segment, because I have noticed, I'll have patients that get burned. I have patients that'll get picked and scratched. I'll have them they'll change up regimens that are not customized to their skin, or they'll recommend treatments that they just don't have experience with. I mean, I'll give you an example for myself. Lasers come to me before you ever see them, before you even hear about them. I just tested three this past week that are going to be out in 2 years. Okay. I understand the science of these. So if an esthetician who doesn't have experience, or let's say even a doctor that doesn't have experience, that starts to see a client of mine and starts saying, don't do this, or I don't, that they just don't have the experience, in my opinion.
And this is what you have a podiatrist or a gynecologist giving someone a thread lift.
Yeah, we have the same. I have dentist patients that do dentist friends that do the same thing. I do a lot of other down under treatments, sensitive areas. And I have urologists and people calling me saying, can you teach me so I can do this? I'm like, who are you going to be doing the treatment on? Your 60-year-old that had prostate cancer? Like, I don't understand. The people coming to see me are not the person that's going to see you. And they just kind of want to do this stuff off the whim. But I've been doing these things for 15 to 16 years now. And I can go through the history of how I even got to this point. Trial and error, lots of experience, a lot of mistakes, issues that people wouldn't know unless they had a lot of experience. The first year I actually started Clear and Brilliant, I did myself 880 treatments in 1 year. And that was the first year before it even just came out, and I had to do it myself. Each one takes about 30 to 40 minutes. So if you actually think of how many just basic Clear and Brilliants I did when I was first starting practice, that's a lot of experience in using a device. And so I've had people, kind of interject in my treatment plans. And I'm not saying I'm perfect by any means, but I definitely am the most up to date of anyone in the industry. And so the biggest thing with me is I would rather an esthetician or a less experienced physician or someone new in the industry call me and say, we have your client, let's collaborate on how we take care of this person. I do a lot of body surgery, liposuction. A lot of my patients come for 2 weeks, then they go home and they need to get massages and radio frequency. There's a few cities where I literally have people calling me screaming on the phone. They're so happy that a client of mine came to their office. They can't even believe it. What do they need to do? And I collaborate with them on every step, because we want the best results for this client. But I think it's really important, if you don't have the experience, that you need to either do the research for it or collaborate so that you can really get the best result. Don't just say things because it's what you have or Sometimes, things that are different may be the future and you don't even realize it because you're in a practice like mine that's very progressive. You're doing combinations. You're using futuristic skincare, smart skincare. It's different. People may not be used to it. They may not understand. And so that's why I think the biggest frustration with me is just making sure that you investigate. Because I had this younger woman, this middle-aged woman from Minnesota that was burned. She came to see me, and we treated her 2 or 3 treatments every 3 or 4 weeks, and she cleared everything. And then when I told her what I needed her to do for maintenance, it took her 3 offices before they actually would do the treatment I told her to get, because they didn't believe that it would work and they didn't want to do the treatment for her. But that's my experience of treating these burns. And finally, one of the offices called me and said, we know you, whatever you say is what we want to do for her. And you know what? Perfect skin now. Beautiful. And I haven't seen her in a year. She calls us every 3 months and thanks us and says, I'm following the exact routine and everything's perfect. It's more about collaboration, and learning and watching these types of treatments and following the YouTubes and really like inquiring, because some things are going to be progressive and new. And you don't want to just do things to do things.
Can you tell those who are watching us about how wound to heal works? Because I think people don't quite understand that process. And that sort of goes back to the question about recovery. Because I have clients ask me all the time, what should I be doing? And I make my recommendations and I say, you should talk to these people. And then they go, oh my God, but do you see what I look like in between? And they freak. How does wound to heal work? And how can we trust that we recover?
Well, this is great because in the old days, when I first started, we didn't know anything about that. And all we did, we would try a laser and we didn't even know what the downtime would be. It could be an hour, it could be 6 weeks. I had clients where we did, fully ablative lasers in 6 weeks to 12 weeks of healing. And all we had then was Vaseline or Crisco. And that's what we used for healing. And that redness persisted forever, a year sometimes. Wow. With that said, we have learned so much and we've progressed so much, even into fractional lasers that have minimal downtime, non-ablative lasers, which with much less downtime, microneedling radiofrequency with almost no downtime. And so you need to do, in my opinion, constant stimulation for collagen production. That may mean every couple weeks a light peel or every month a microneedle. You don't need to burn the surface to really look good. But if you really want to get rid of sun damage, you really want to prevent wrinkles, you really want to get rid of acne scars, you guys, then you got to do bigger lasers or deeper peels or a combination of things every 3 to 4 months, in my opinion. You should be doing a quarterly laser treatment. I do Fraxel or Halo, combined with usually Morpheus or PRP, in between things like Clear and Brilliant. With that said, though, you got to know the downtime and prep, because what's important is preparing for those treatments. Things like the non-ablatives, like a Fraxel or Halo, have 3 to 5 days, predictably, now that we know after years of experience, versus CO2, deep erbium, combination deep peels, a week, 2 weeks. Even Renuvion resurfacing, you guys, which only is good for skin types 1 and 2, in my opinion, very light skin, 6 weeks of downtime. So you really have to go to somebody that knows, because if you don't supply immediate hydration, barrier repair, the right type of exfoliation, like you're talking about stem cell factors, growth factors, and peptides, you will not heal properly. And you can get streaks, pigmentation, redness that persists, scarring. I have patients, and I posted on my Instagram live the other day, very deep CO2. I mean, almost fully ablative combined with fractional, very deep in a young Hispanic male. And day one, looking horrible, because the first 24 hours is when everything's crusting, scabbing, healing, but we need to exfoliate that. We need to get those stem cell factors in the skin. We need to use soaks to prevent hyperpigmentation and infection. But by day 3, we had him at 2 weeks of healing by day 3 because of hyperbaric oxygen, oxygen facials, growth factors and stem cells, at proper exfoliation. This is from 16 years of learning how to take care of the skin. And he will have minimal hyperpigmentation. We know this, that will go away, but he will heal perfectly and the result will be better. What we're talking about at your end with prejuvenation or proactive is very light wound to heal, just a little redness, sunburned look. But that look can still generate a ton of collagen, and you need to supply it with the right hydration and growth factors, and then we can predictably say how well you're going to heal and look, with whether it's 24 hours or a week. But I have a full regimen, and what you talked about, the 28 days, I almost feel like we need to make a YouTube describing that and saying, like the 28 days.
Horror movie this time.
All right, well, that's fine. We'll do one with acne scars and one with getting ready for the red carpet. Totally different.
Amazing.
But it would really educate people on, not just the one and done, in understanding, like even The Rock, who, like, I literally watch his working out every day. He's eating right, supplementing, working out so that he could look his best for his films, for his advertisements, Under Armour, everything. It's the same that we're doing here for skin. We need to prepare it. So when we have a specific laser, there's a specific prep and protocol. When we have a specific maintenance, we're calling you up and we're going through the plan. That's what really needs to be done. And it's a combination of using the treatments that you're describing.
I think you're right. I think there's so much disconnection between those of us who are working on a regular basis and working towards a certain goal for an occasion. And then we have our clients run off and go rogue and go to
I agree.
this doctor for this and this doctor for this. And then there's no communication. It's like hiring 9 different interior designers for your home and wondering why it looks crazy. But I want to ask you something, because my clients would be so annoyed if I didn't. These things I hear all the time. Gavin, what can I do about this? The wattle between the chin and the neck, right? And then they also ask me, I work out all the time. I follow my restrictive diet, my Hollywood, starvation protocol. I the belly fat under my belly button to budge. What are your advice about the technology that you offer that can deal with that?
Well, look, there's a lot of options nowadays. There's everything from non-invasive, meaning zero downtime, True Sculpt ID radio frequency treatments. They're panels that heat the skin, tighten it, and reduce fat. Cool sculpting for larger areas that reduce fat and help tighten the skin. All the way to surgery like I do, where we do neck lipo, we do early facelifts even, where we do mini ones, where we make little incisions here and just around the ear. Or in between, where we just go under the skin and heat it and tighten it, like Face Tight or Renuvion. Literally 3 days of downtime, and that's it. They're asking if I'm a Hollywood doctor. I am a Hollywood doctor, just so you guys know. But I'm a Midwest guy, so I always say I'm a Midwest guy stuck in a 90210 zip code. So with that said, because I'm normal, I'm just completely normal. With that said, it's really expectations. What does somebody want? The bigger we go in steps, the bigger the results, right? An earlier facelift is going to give you much more than doing a True Sculpt treatment on the neck or doing thermogenol therapy, which are heating treatments and muscle tightening. I think everybody should be doing deep microneedling every couple months, so Morpheus treatment on the neck. But if you really don't like it and you want something one and done, you want something quicker, bigger, Face Tight or Renuvion internal heating is 3 days of downtime. It melts fat and tightens the skin. It's very minimal. And you could do thread lifting, which everyone seems to do. It's just making sure it's done well. And Botox on the neck helps tighten the neck. I did a video last night. It's on, or yesterday afternoon. It's on my Instagram TV of doing these platysmal bands, tightening these bands.
Yeah.
If you do Botox here, it pulls in the neck. So there is a lot of options now for this area. I have people fly in, they get a laser and Face Tight. 2 days later, they go home. At work on Monday. Looks like nothing was done. It's unbelievable. Jawline filler is a big thing right now, because if we project the chin, we widen this tightens up. It gives support to the area. So there's so much. I mean, threads, microneedling, filler.
The jaw, I'm like, please, because there is a tendency, because I've done it before, and there is a tendency because you get really addicted to the look when you...
I know that we call it the snatch jaw.
Yeah, but it looks crazy if you walk around all the time with the jaw.
I know.
Like you're
I agree.
Japanime. Okay, belly fat.
So belly fat, again, same thing. When somebody comes in, they have looseness. We have to address that first, because if you have fat with looseness, that's more difficult. Looseness needs either skin removal or it's going to need some sort of heating. True Sculpt ID, which is non-invasive, does more heating than Cool Sculpting. It's better for tightening and for fat reduction. But if you need surgery, we could do internal heating. There's the newest treatment, Renuvion. I actually helped pioneer. We never thought it was going to be as successful as it is. Now, the gold standard of lipo is liposuction plus Renuvion. But if you have skin, if you've had kids, you've lost a lot of weight, sometimes you need the skin removal. And you guys know on my Instagram, you see me doing tons of tummy tucks and chest lifts for men and stuff like that, because we might need it. Now, what's cool is if you have crepey skin, that's different. That's like cigarette paper or fine wrinkles. You need to treat that like the face. You need to do peels, you need to do lasers, and now we're even doing plasma pen, which is the newest radiofrequency plasma device. It makes little holes in the skin, tightens the eye skin, this little crepey skin, tightens wrinkles around the mouth, and it's amazing around the belly button. Tightens skin around the belly button. If women have very thin skin and they want that little, like I say, turn the frown upside down on the belly button, it tightens it up. You do little dots of plasma pen. These little scabs form. This is wound to heal. And it takes 3 to 5 days for those scabs to come off, sometimes even up to 10 days. But if you're using the growth factors and the peptides, you're going to prevent little dots from forming or little redness and irritation in that area. You're just going to get tightening.
One thing I've been doing a ton, and it's not FDA approved yet, but keep it on your back pocket.
Tell me.
Part of it's called Profilo. Have you heard of Profilo?
Oh yeah, all the time. I've heard about it for years. It's people really like it. Talk about it.
So I've done it maybe 3 years in a row, and I send every client. I'm like, if you're going to Europe for a press junket, you've got to go here. It's moisturizer. It's a non-cross-linked hyaluronic, so you're not adding volume, and you put it here, 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 and here, and you sort of come up. Some people see bee stings. I like to think more like Kruger's bottle caps.
Mm-hmm.
You go to bed, you wake up overnight, and it basically doesn't stay localized. So it knits together to flood that upper level of epidermal with so much hydration that it literally just makes you look juicy, goosey, baby, barely worried life.
So
a year and a half.
I want to tell you that. So about that. So we do mesotherapy in my office.
Yeah.
It's a very unique technique originally from Italy. There's different techniques. There's nappage, which you tap the skin. And there's also injection mesotherapy, very common in Europe. There's one filler in the US, Belotero Balance, that actually does integrate directly into the epidermis. Yeah, and you can actually do very little dots, hundreds of them, all over the face. You look like you have, what is that movie? What'd you say?
Hellraiser?
Yeah, well, no, that's when they are popping out, but I love that. No, where you have like little dots, almost like a tribal tattooing kind of. And then in the next day, it's gone because it softens all through the skin. I do that actually on my clients every 6 months or so, where we do Mesotherapy Hyaluronic, which is very similar to what you're describing. There's also actual mesotherapy products from a company called Mesoaesthetic that we use that actually have different hyaluronics and different mixtures of vitamins with hyaluronic that we mesotherapy the whole face. We actually use a little gun and we inject it with a little gun on the skin to get the skin to really plump. So what'd you say?
It's different from the skin boosters that Alex.
Yeah, well, no, it's very similar. Very, very similar, like Restylane Skin Booster or whatever we don't have in the US. Okay. But I do think there are alternatives for people if they can't go to Europe. They could easily come to me here or in New York, and we could do some mesotherapy and actually integrate it with the stuff that you're doing. There's a lot that can be done. Belotero can be injected for wrinkles, but you can actually thin it out a little bit and literally just go through every fine line, full face plumping. You look like you've been stung by 100 bees. And then the next day, glow. It's really unbelievable.
Really by the way, guys, this is what Sleeping Beauty was really doing when she was knocked.
Exactly. But she had the funds to do it too. So that's the biggest issue.
What like that cost?
I think that's probably $1,000 to $2,000, maybe $1,500, $2,000. So it depends on what you use. If you're doing a smaller area, it could be $500 to $1,000. If you're doing very large areas, it could be more. Or if you're mixing in vitamins or combining it with something, I tend to like doing a little bit of microneedling or some sort of light collagen stimulation during that time because it opens kind of the channels a little bit. It's really great for around the mouth with people with smokers' lines because we actually will fill the line first with like what you're describing, Belotero, and then I'll do the mesotherapy hundreds all around, and then the next day it's smooth. I mean, it softens and it opens the epidermis. So we're getting really late. Okay. I think, was there any last thing that you think we should tell everybody because it's got a lot of engagement today?
Yes, I would say wash your damn face. And this
right.
I say to people all the time, I'm like, wash your face one time in the morning with a light, gentle cleanser. You haven't gone through too much in the night, I hope. Wash your face before you go to bed twice. So I love to take more like a balm cleanser and then finish it up with more of a treatment cleanser, just to make sure that I'm working on the exfoliation, that I'm adding vitamins and sort of lovely actives to the skin so that we really get the skin squeaky clean, so our skincare and all of our other more intense treatments do their work. But wash your face and wear SPF, minimum of 50 every day. Thank you.
I agree. Love that. So you guys, Lord Gavin, one of the world's leading expert on taking care of celebrity skin. He's also a huge brand ambassador for Augustinus Bader, which is one of the biggest skincare brands in the country, but not only because it's well known, because of the science behind it. That's why I actually love talking about it, because even my own skincare line was really about producing quality products that have science to support it.
Yes.
And with what you're doing with smart skin and really signaling at the deeper levels, this is advanced stuff. This is progressive, which is why we wanted to have you as our first guest. And I'm excited to do so much more with you in the future. So I appreciate it. Thank you so much.
It's been a great pleasure and such a joy. Thank you, everybody,
You're
for
the
joining.
best. Have a great Sunday.
Take care. Bye.
Bye. You guys, that was such a great KOL. This was all about education, education, education. Went a little longer than we normally would want to do, but you know what? I just want to get that information out for you guys. We are going to have so much more coming with amazing celebrities, influencers, beauty gurus. We have so much to talk about with regards to skin. Please support Aerify and all the Aerify kits that will be coming out in the near future at emeragecosmetics.com and our skincare line. And do our consults, because we can go through everything you need to keep your skin healthy and fresh, whether it's in the office or at home. Bye, guys.